Not because we told you, not because we've given you a book or assignments, but your gut will be totally transformed and you will be a new person. If you know people who are thin, you notice, surprisingly, that these thinner people seem to, without a lot of effort, eat somewhat healthier. They eat a little bit less. They stop before the second portion. Not because they keep track of it, not because they have a little 3x5 card telling them to eat 3 exchanges at Weight Watchers, but just for some reason their gut stops them. We would argue that's because their ghrelin is well balanced. And in the new you, with your smaller stomach, the bypass, and the decrease in ghrelin, you're going to have this wonderful experience where this battle that you've been in all the rest of your life to stay thin goes away. My patients tell me that preoperatively, they think about food all the time. When they're eating breakfast, they're thinking about lunch. When they're eating dinner, they're thinking about dessert. And when they're finished and stuffed with dessert, they're thinking about a snack on the way home from dinner. And that's not because they're bad or weak or anything like that. We think that is ghrelin. The hormone in them is off. And after surgery, people say, you know, it's funny, I feel like I have more hours in the day. Because now I just eat because I know I have to eat sometimes. And that drive that constantly sent me to the refrigerator, constantly made me eat, goes down. And that's one of the most enjoyable, one of the most wonderful things is that release from constantly being pushed to eat. And then for your wife, for the husbands who are here, the support people who are here, you don't really need to worry about being the policeman anymore. And we talked a little bit about that in the future, that oftentimes, you know, your spouse acts as kind of the governor, you know, the person who tries to keep you on the straight and narrow, because you know for your diabetes, you're not supposed to have cookies. You're not supposed to have cake. You're not supposed to eat that fudge. And is that your 4th cookie? And are you eating that whole bag of potato chips? And so that spouse has taken on that role because they care about you, because they love you. They end up being in this kind of the mean teacher, you know, or the bad, rah, 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 why are you doing that? Rah, rah, put that down, don't do that. And that whole relationship is about to go away. You don't need that anymore. We will take care of that. The mini-gastric bypass surgery is going to completely change your lives. That whole fear of constantly worrying about losing your husband to diabetes with a heart attack or a stroke, all those things are about to be transformed this morning. As the cliche goes, today is the first day of the rest of your life, and it's a wonderful transformation. You've talked to other patients of mine?
Yes.
Right? Mm-hmm. This is what they tell me, that in the past, it's been a very scary, tough battle against obesity, and especially against diabetes, which is a killer. Diabetes unchecked, diabetes in a patient who doesn't avoid cake and cookies and things like that, is a progressive, debilitating disease that leads to blindness and heart attack and stroke and death and amputation and kidney failure. So it's right for the spouse of a diabetic to fight like a tiger to try and protect her husband or his wife against the devastating ravages of diabetes. But today that is over. Today that's over. And it didn't work well before, and it's not necessary in the future. And that's really one of the most wonderful things about this new you that we're about to put in place today. The new gut with the lower ghrelin level means that your husband is going to walk in after work, and if he has a cookie, that'll be it. There won't be anything else besides that cookie. There'll be that bite, and that's it. And that's really the wonderful part of this. In addition, in the past, a lot of our patients come home from work and they collapse on the couch, and they're done. That's not true anymore. Now, you're going to come home from work, if you're like our other patients, you're going to say, hey, let's go. Let's go shopping. Let's go see the kids. Let's go take a drive. Let's go for a walk. And that transformation, again, is part of the wonderful new life that happens starting today.